Diabetes is one of the most common diseases in the Gulf and the world, as the number of people with diabetes grows worldwide. This epidemic will continue to grow and increase even worse. Diabetes is also projected to become one of the world's main disabler and killers within the next 25 years.
Diabetes is a metabolic disease characterized by high sugar levels. It is common in the world, especially in the Gulf countries. We diagnose diabetes when the fasting blood sugar exceeds 120 milligrams per deciliter and when the postprandial or random blood sugar exceeds 200 milligrams per deciliter.
When a person has diabetes, fasting during the holy month of Ramadan will be an important spiritual practice. You may be wondering how fasting will affect diabetes. Moreover, there is a lot of misinformation about diabetes and Ramadan.
See, actually, it is tailored on individual basis. Each and every patient has a special situation. Those who are insulin dependent, it is really difficult to manage. They have to consult their doctor. But generally speaking, it is easier for those with diet control. Generally speaking, they should counsel their doctor. Frequent small meals, avoidance of sweets, avoidance of oils, and plenty of water, with regular checkup of their blood sugar.
When your heart beats, it pumps blood around your body to give the energy and the oxygen it needs. As the blood moves, it pushes against the side of the blood vessels, and the strength of this pushing is the blood pressure.
Usually hypertension, it means is elevation of the blood pressure. It means high blood pressures. This is a common disease in our countries. Most of the populations may complain from it. It means a persistent elevation of blood pressure, the systolic more than 140 millimercury, the systolic, and we have the diastolic. When it's elevated more than 90 millimercury is regarded as hypertension. It's a common, and also it's called a silent killer. Why it's called a silent killer? It means it may cause a lot of complications without symptoms. In general, during Ramadan, we have certain few restrictions about it. First, regarding the diet, most important things. For the diet, we have to restrict the salt. Salty diet should be less salty or have salty diets, and low-fat diet. This is important thing. About the medicine, the patient, he have to continue on his medicine as the usual, but it need to restrict the salt, and if he can, to encourage the exercise and to maintain a healthy body weight.
As a majority of the United Arab Emirates population suffers from hypertension, the heart doctors have warned that fasting could shoot up their blood pressure even higher. The blood pressure of these people will shoot up at iftar time when they eat sweets and salty food. Diabetes and hypertension are the era's diseases, and they should be carefully treated to keep people healthy. For the Health Show, this is Nida, the KSA2, Dubai.